Good afternoon, everyone. My name is Sreenidhi Maddineedi, and I am a certified EMT, and this is my presentation about the emergency medical services and careers in the U.S. So being an EMT really is, in the strictest definition of the word, a life-saving career, and I hope today you guys will join me in exploring the world of emergency medical services. So first of all, what does it mean to be an EMT? Sorry about the font, I think it didn't sync properly with PowerPoint. But essentially, being an EMT, so EMT stands for Emergency Medical Technician, and basically being an EMT means that you are a trained healthcare professional who's able to respond to a wide range of emergencies and different crises. So talking about the different types of emergencies an EMT is basically trained to respond to, we have medical emergencies, so when patients are having seizures, strokes, MIs, heart attacks, and that such. Traumatic injuries, so the patient experiences like a very severe fall or car accidents and anything of such nature, as well as respiratory distress. So you guys are probably familiar with respiratory distress in the context of like an anxiety attack or asthma or like let's say anaphylaxis, which is like a very severe allergic reaction. So responding to that in really any sort of situation of when a patient has severe shortness of breath. But also we respond to environmental emergencies. So you're probably familiar with the recent fires that have been happening in Southern California. So responding to any sort of person who might need care or medical attention in such an environment, as well as general emergencies such as overdoses and psychiatric crises, which have unfortunately become a very big uptick. We've seen a really big uptick in them in the pediatric population in the past few years. So talking about an EMT, we have to also address the stuff that they're doing. So an EMT's main job is to respond to 911 calls and really, again, those emergency situations. As an EMT, again, you are providing life-saving care. And life-saving care can be anything from performing CPR to controlling bleeding, immobilizing patients, stabilizing fractures, as well as administering medications such as epinephrine and oxygen. As an EMT, you basically are able to administer 8 medications, and that'll vary depending on what county you practice in, what state you practice in. Paramedics have access to a bit more, they have more medications at their disposal, again, because of the level of training that's involved. But also as an EMT, your main job is to transport patients. And transporting patients can mean not just to a hospital, but also realizing what appropriate facility they should be transported to. Patients who have been in fires, for example, might have to go to a level 1 trauma center or to some sort of burn wound or clinic. So really, again, just distinguishing what place to be able to treat the patient best is also the job of an EMT. And also another job is to communicate effectively with patients, families, and the healthcare teams. A big part of EMT is also, especially when you're responding to pediatric calls, being able to comfort the family and show them that while this is something serious that you're going to be taking the appropriate care and attention for, being able to comfort the parent and making sure that they're not also adding to the anxiety of the situation. Another thing as an EMT is that you're responsible for giving patient care reports to the nurses or whatever member of the hospital that you're handing off the patient to. You guys who have taken biology might be familiar with PCR in the context of polymerase chain reaction. We're using a different definition of that, where it stands for patient care report. So how to become an EMT? So there's some basic requirements to become an EMT. One of the things is that you must have a high school diploma or some sort of general education requirement. So with that, of course, being 18 years of age. And you also have to obtain appropriate CPR certification, which is from any sort of approved organization, generally those that are affiliated with the AHA or the American Heart Association. You should also complete an approved EMT training program, and these can range anywhere from 4 to 6 weeks to a few or even several months, again, depending on whether these courses are full-time or if they're part-time. So an EMT training program includes both classroom instruction, so again, that's why it sort of ranges in the time period, because it depends if your class is going to be like every week versus like just a couple of days a week. Also includes hands-on training and clinical experience, so oftentimes in ambulance ride-alongs, for example, working with FALC or AMR, which are the really popular ambulance agencies here in Alameda County, as well as things that are inter-facility transport, so basically like when you're moving a patient from, let's say, Washington Hospital, maybe UCSF, again, just so they can receive the more appropriate level of care. We call that IFT or inter-facility transport. Now, the next step, and one of the biggest ones, is passing the NREMT exam. So the NREMT basically stands for the National Registry of Emergency Medical Technicians. So the NREMT administers, of course, the EMT exam, and if you live in the East Coast, there's another step called the AEMT or the Advanced EMT. So to become an Advanced EMT or even to become a paramedic, you're just taking more of the NREMT exams, and these are both cognitive and psychomotor. So psychomotor basically means can you do so-and-so procedure, there's roughly 8 of them to become the EMT, and the cognitive exam is anywhere from 70 to 120 questions, computerized adaptive exam that I believe is now administered by Pearson here in California. And then you also have to apply for state certification. So to get state certification, again, you have to contact your state's EMS agency, just because some states have more requirements than others. One of the big things is, of course, getting your ambulance driver license, which is a fun process in and of its own. But to get state certification, again, you have to go through background checks and various different things at your state's discretion. Another thing also is that, especially here in California, you kind of already have to be employed by an EMS agency who will then sort of sponsor your application to the state EMS agency and also to your local county office. So skills needed to succeed as an EMT, these are pretty general actually across the healthcare professions. But of course, you need to have soft skills and technical skills. You have to know what you're doing because you are performing, again, life-saving procedures. So again, bleeding control, CPR, fracture stabilization are all these basic things that you have to be able to know how to do, almost with your eyes closed, because again, you're working these very high stress and very intense environments. You have to know how to use medical equipment and be able to very comfortably handle it. You have to be able to get patients on and off stretchers very, very quickly. You have to be able to use defib machines, so the AEDs that we were showing earlier with our CPR instructor. You have to be able to handle oxygen tanks, and these are also very heavy equipment, so you have to be in good physical condition. You will have to be able to assess patients very quickly and accurately as well in high pressure situations. If you have a patient with shortness of breath and you go ahead and give them myocardial infarction treatment, you're not really doing anything. You might actually be exacerbating the situation, making it worse for the patient. Now, as far as soft skills goes, to be an EMT, you have to be very, very good at communicating efficiently and effectively, especially between you and your partner. You also have to, again, be in physical fitness because you're lifting these patients and the equipment, often under very challenging conditions. Many organizations here in Alameda County actually now have their own physical fitness tests their new EMT hires have to go through, just again to make sure they are actually able to be in these sort of different environments. Emotional resilience is another big thing. You have to stay calm and focused during emergencies, and oftentimes, especially again when you're working with children or these pediatric populations, it's very easy for a call to get to and really weigh on, especially new EMS agents. So being able to sort of handle these different situations is another big thing. You also have to be a very good problem solver, again, because you're making quick decisions in very unpredictable scenarios. Now, why choose EMS as a career? So being an EMT is, again, in its strictest definition, it's a life-saving thing. So you're providing critical care in emergencies, and you'll be directly impacting your community by helping people in their most vulnerable moments. It's also a good way if you are planning to pursue any other careers in healthcare, for example, going into perhaps trauma medicine, or even if you're going into nursing. It's a nice way to sort of get your feet wet in the sense of like you're working with patients like in clinical experience in its most strict definition. And oftentimes these training programs are relatively short, especially compared to something like nursing, where it could be several years, and don't even get me started on medicine. Here, it's really just 6 weeks to several months, whereas something like that, you're looking at years down the line. It's also a very affordable education compared to, again, nursing or medical school. But that's essentially that. So in terms of career growth opportunities, you can basically advance to becoming a paramedic, a firefighter, again, pursuing the nursing or other healthcare roles. And it's very, very valuable experience that can open doors and higher paying positions in the medical field. So most times, or more often than not, you'll see people not really just starting at the EMT level, they'll go ahead and become an EMT intermediate or AEMT, which is something we see more so in the East Coast than here in the West, especially in California. But after becoming EMT, most people also become a paramedic. So to become a paramedic, it's a sort of a one-year internship with different ambulance services, and of course going through another training course and oftentimes more rigorous education as well. Many times firefighters will also have some sort of EMS credential, generally as an EMT, and also you can become an emergency room tech, and these are just sort of the things that we see straight down the line. There's a lot of medical students who will also become an EMT at some point during their undergraduate or even med school career. And talking about the work environment, so being an EMT and actually just working in EMS oftentimes is a very exciting work environment. No 2 days are ever the same, be that working in hospitals, working with ambulances, or even in disaster zones. Frankly, no 2 calls are the exact same as well. You're very much part of a fast-paced, team-oriented environment. As an EMT, your best friend is essentially your partner who's on your shift. You spend basically 12 hours on shift, and oftentimes with the exact same people. So being able to really work effectively and also being able to handle that sort of team aspect is another big thing about being an EMT. So talking about salary, benefits, and job growth, again, because this is a career presentation. So being an EMT oftentimes has decent salary, which again does vary by location and also by what type of EMT you are. If you're working with 911 or if you're working mainly in IFT, there is that pay gradation. So cities like New York or LA, and these bigger cities can pay anywhere from like 41 to 51,000 yearly. Again, this is like based on the full-time aspect and presuming that you are just an EMT, not a student as well. But the benefits of being an EMT is that most services do offer educational scholarships or some sort of tuition reimbursement. Royal actually, which you guys might see driving on the freeway, Royal does do things where like they can help pay for students who are becoming paramedics, or also for undergraduate students who are doing this alongside pursuing some other sort of bio or healthcare degree. There's small comps that they'll do over there. But there's also various sign-on bonuses as well as health insurance and retirement plans. And in terms of job growth, EMT jobs are predicted to grow almost 4%, and this is from between 2018 to 2028. Right now, we have over 178,000 EMTs employed in the US, with over 137,000 active job openings. So it's a career that's definitely ripe for different opportunities. So again, taking the first step to become an EMT, just get started. I mean, you'll never know until you actually try to do it yourself. So again, researching local EMT training programs, and of course contacting your state EMS agency just to see what other opportunities there might be, or if they have other sort of requirements you can meet. Shadowing EMT as well. Arrange a shadow an EMT for at least just a day or even for a single shift to really get that first-time experience of what it means to not just be an EMT, but interacting with patients in these sort of environments. A lot of you might think of an EMT as the sort of person who's riding around with an ambulance and going to like these very intense environments all the time, like going to fires and rescuing people from car crashes. But sometimes it can also be something where you're just like, you know, talking to an old elder person, sort of just comforting them in this sort of very anxiety-ridden situation for them. So just sort of seeing the entire range of calls they might get is also an incredible experience. And of course, stay informed, so follow local EMS departments and fire agencies and such for social media updates and job postings. Online forums and groups, maybe not Reddit, but something of the nature, for aspiring EMTs is also a good one to stay connected, and especially when you're taking the NREMT, because it's an adaptive exam and they're always making changes to the curriculum, so just staying connected and having other people who are going through the same boat, that's always nice to have. But if I could stress one thing today, it is the impact of EMTs. EMTs save countless of lives by providing critical care in emergency situations. Their dedication and expertise are literally crucial in ensuring timely medical interventions that make a significant difference between life and death. So with that, these are some of the references from throughout the presentation, and thank you so much for joining me today to explore the world of EMT.
Thank you so much for your presentation. And next we have a presentation from a physical therapist at Kaiser who specializes in occupational medicine.